to Code Wind Talkers. I'm Darren Aquino. This is Johnny Frantangelo. Everybody calls him Johnny Pizza, and they call me the Cricket. We have a special show for you today. We have our special guest, who is not only a special guest, he's a renowned doctor. He works also with advocates for disabled Americans, veterans, police, firemen, and families. He's working closely with veterans and folks with disabilities. We're trying to put some new projects together, and his name is Dr. Mikhail Artamonov. And we call him Dr. Mike, and we hope you call him Dr. Mike. He's here. He's going to answer some questions. If we get any other questions, he's going to answer Johnny Pizza's questions. We're going to talk about disabled veterans in crisis, what type of plans he has for the organization and his position. He's the chief medical officer and advisor and consultant on services for our service members, for the men and women who serve this great nation. And he's a good friend, and he's been with the organization. And we're so happy to have him. Last week with technical difficulties. It's been crazy. But as you know, we're coming from Triple Vibes Radio. It's associated with Code NYC, Sunrise Magazine, and CV19. And on CV19.mag, CV19mag.com, you'll see Dr. Artamonov there. He's the featured story. He's also a contributor to the magazine. It'll be on a regular basis, updating you on current medical issues and science as we progress as a nation and where this COVID is going. As you all know, I had COVID. Doc was with me closely working through telephone. Everybody was rushing to get me better because it was a very unpleasant time. But I'm here now. So, Johnny, you want to say a few words, and then we'll bring in the doc, and let's get this show going. We're going to have a great show today.
Okay, I just want to welcome everybody to the show. Thank you. I'm John Fratangelo. Thank you, Doc, for coming on. I just have to ask you a question. Me being a layman, I work with my hands all my life, okay? And when somebody asks me to come and do a job for them, I'm a plumber, okay? I know I make a list of the material I need, okay? I know what I want to do and how to do it. Now, you people, doctors like you amaze me. You're throwing this virus, this new COVID-19 virus at you. Now, how would you know where to start when something just comes out of you from the thin air? It just amazes me, you know?
You mean the science of it, Johnny?
Like how would they know?
How would they know where to start? I mean,
they're dealing with a microscopic, organism. You know what I mean? I'm not. I go by the pipe. I go by the fittings. And it's there. But they're dealing with something that's just invisible and have no knowledge of where it came from.
I get that. Doc, he wants you to explain it like a plumber so he can understand the science. I get what he's saying. He wants you to say, how do you come up with a solution for this? What's your first plan of action when a string of this, like this COVID, like I got it. We were on the phone. All of you were worried about me. What is your first plan of action when something like this hits a country?
Well, first of all, thank you for having me on the show. And it's a pleasure meeting you, gentlemen. It's a great question. There is a short answer and there is a long answer. Let me give you the medium one. We as the doctors, most of us work with our hands as well. I wish we would use our brain more often. But current healthcare is all about protocols, so it's a hands-on. So you're absolutely right. How you deal with something that you don't touch or you can't touch, can't see, something that threatens our life, like this virus. Well, it's a story of development, and Darren was a part of that. There is a different schools of thoughts here. One is, well, we have to touch that first. So let's find out what's the source of the disease. Let's kill it, chase it down and kill it. And it's a long-term discussion in medicine for last several centuries. Are we chasing the bug? Are we chasing the virus? Or we're strengthening our defense system. We're strengthening our human perception. Therefore, we don't need to chase every single bug. We just make ourselves stronger. We make our country stronger. We make ourselves stronger. That's how it works. So I belong to the certainly to the second school, even though we have to find that tiny virus. But the way we developed our program, including those to help our veterans and all disabled people and everybody in this country, is to strengthen our immune system. So that way, we don't need to chase every single bug, but we make ourselves stronger.
So instead of the first plan of attack, then would be to strengthen the immune system, and that's pretty much we heard a lot of that at the beginning, even when you were prescribing for me to take these vitamins and these immune builders. That is the best course of action at the beginning, then, right? To strengthen the body, because
Yeah, so what happened? We all witnessed that. That's this COVID pandemic is a great example on how much, or I should say, how little we still know about ourselves, how disarmed we are and turn out to be in the face of these pandemics as a doctors, as a healthcare. As a matter of fact, I'm pretty sure I'm not saying something that nobody thought of, but I'm sure we would save more lives if we knew what we were doing. But there was a trial and error pathway. There's a lot of lives lost because we didn't know what we're dealing with. And more importantly, because we established and followed the old paradigm in medicine to chase this invisible bug, we have to find that and destroy that. And that's the major mistake from my standpoint. When the pandemic started, the first response of our group in the first week of March, second week of March, was to create the line of immune defense supplements for people who can protect themselves against anything. Doesn't matter.
I have a question before I want you. I'm going to give you a question. We're going to talk more about it before, but then I want the people to know your credentials and what you do and what kind of specialist you are in this. So my question is, how, in the beginning of this, well, not at the very beginning, they targeted after it was out there for a couple of weeks. They said the vulnerable. How did they determine underlying conditions that they would suffer? How did they come to that conclusion that I have the COPD from 9/11? How did they determine that if you got diabetes, if you got a heart, how did they determine that? I'm sure the viewers would like to know, how do you come up to these conclusions?
See, Darren, you're asking questions that's by far smarter than the doctors ask themselves. That's a damn good question. How we determine, because it's a continuum of health and disease. Nobody becomes sick out of nowhere.
Right.
I would say more than that. I would say sick people become sicker when they meet the virus. To put in a little bit more scientific perspective, that's exactly what our group was dealing with. We published the article in the last week of March about so-called inflammatory response or cytokine storm. And the idea is that, hey, we have people who suddenly die, regardless of COVID. Let's say you have a heart attack. 60-70% of people who are major consumers of this year healthcare expenditure were at the bottom 5% of the previous year. What it tells me that you're walking and talking like a healthy person. There is nothing you can find about yourself that gives you some sort of warnings. And then suddenly something happens. You have heart attack, you have this, you have that. Why? Why we didn't pick it up that you were working on a fine line between the illness and disease, that your immune system is compromised already. And that's exactly right. It's a continuum between the health and illness. We just have to identify that, where in that continuum that particular person is. In answering your question, we know 1,200%, over 1,000% more mortality in people with congestive heart failure or heart disease from COVID compared to those without, underlying conditions. That tells us a lot that it's not the COVID. That's your immune system. That's your body that was weak already that get hit by that. And that's what we have to switch our focus towards that.
So then it would be fair to say that it's the actual immune system and not so much the underlying condition, but the underlying condition is what compromised our own immune system that made us vulnerable to this virus, this invisible virus. Would that be fair?
Well, otherwise, yeah, it's one of the certainly visible explanation. Otherwise, how would we explain the fact that 60-70% of infected people are asymptomatic? They have no symptoms, not to mention they don't go to the hospital. And only 10 to 15% of people infected with the same virus go for the severe form. They go to the hospital, they get on ventilators, they die. How would you explain that? So the only explanation in my mind is something that makes you more vulnerable than me towards the same pathogens. And what it is, that's your underlying condition, underlying health.
Doc.
Okay, hold on. Let me just take a second station break here to talk about the show. You're with us live here at Code Wind Talkers. I'm Darren Aquino. This is Johnny Fratangelo, combat Vietnam veteran, and our special guest, Dr. Mikhail Artamonov. And he did an article with us. He's partners with ADA, Advocates for Disabled Americans, Veterans, Police, Firemen, and Families. And he's the chief medical officer. We're talking about the COVID situation right now, how some of our disabled, vulnerable veterans have suffered from it. Because as you know, Johnny Fratangelo, Johnny Pizza, as we call him, is a combat Vietnam veteran who does have a disability. And as you know, I'm the CEO and founder of Advocates for Disabled Americans, Veterans, Police, Firemen, and Families. And today's topic is about healthcare, and we have a health professional. And you could see the article here. There's some of this article is online already with cv19mag.com. And Dr. Artamonov is an expert. And he's not only an expert, he's our friend. And he's here to listen and hear. And there's a lot of controversy going on. So that's why here, we're not a social media outlet. We're a live talk show, real questions, real answers, all truth, no lies. You get it here, you get it straight. So back to the doctor. Johnny, I think you had a question.
Yeah, I got two questions. For people who don't really understand this COVID, can you tell us the difference between pre-systematic, systematic, and asymptomatic? That's my first question. The second one is, there's a lot of people like that, like me. I have Sjogren's syndrome, and my daughter has lupus, pretty chronic case of it. And we've been taking hydroxychloroquine. And I kind of feel kind of confident that's kind of helping me to prevent from getting this disease. And plus my attitude of not fearing it, I don't fear it. And I think that has a lot of, to my opinion anyway, I think not being afraid of it has a lot to do with not getting it.
So I guess you're saying by the spirit of your thought.
Right.
When you refer to that. Doc, what do you think about that? That plays a big role, right? Like, you know, confidence in yourself and good spirits, because that plays a big role in attitude. Because I like people that had cancer and overcame it. Some of it was the fight within them that helped them, overcome it. So is there some validity to that?
Johnny, great questions. By the way, I have disclaimer. I don't count myself as a COVID expert. I'm just a doctor who is dealing with that, like many thousands of doctors, healthcare providers who deal with some part of that pandemics. Maybe we spend more time initially trying to organize this process, but I certainly don't count myself as an expert.
No, not an expert, not an expert on COVID, expert doctor.
I'm just thinking, and I think that's the job of doctors. Answering your first question, how you approach this invisible threat? Well, we have to think, and we have to apply all our knowledge and experience, which sometimes is not enough, like this pandemic showed. But answering your question, Johnny, of course, this symptomatic, meaning that you have symptoms. Let's say mild symptoms of COVID, we all know, some cough, some loss of smell, loss of taste, maybe mild fever. Severely symptomatic patients, that's an extreme, that the people who go to the hospital, they put on ventilators. That's the people with severe, very often underlying condition like diabetes and blood pressure and so on and so forth. And as I mentioned, 60-70% of all of us are asymptomatic, meaning we have no symptoms. But if I do the test for you, you have positive COVID test. So that says a lot about the whole continuum of symptoms. So the same pathogens may cause totally different reactions. Your second question is absolutely in the same kind of line. You know, if you have underlying chronic disease, especially autoimmune disease, meaning that your immune system is compromised somehow, you're certainly in a higher risk of inappropriate or inadequate immune reaction to new pathogens. But somebody like you on Plaquenil or hydroxychloroquine, it certainly has protective effect in a way, and it's very safe medication. We've been using it in medicine in the right dose, for a long time. It's one of the safest medication. So when these rumors, by the way, about Plaquenil came that you can use it, the study was done in the doses that 6-7 times more than what we use. So of course there was more side effects and mortalities, and people died. But again, it's, you know, everything else in medicine is a dose dependent. Like in life, you have a little bit of, like Darren is a chef, you know, he's great in making wonderful Italian, you know, dishes. You add a little bit more, and that's it. You're done. So the same principle in medicine. Everything has the right dose.
Well, it's funny you say that, Doc. The symptomatic. You know that I couldn't breathe, and I was sending you other correspondence from the other doctor in the Pentagon, and you were going over the thing and telling me to take this and take that. It even went to a blow dryer because they were telling us, and you were telling me, this starts, if you breathe, it goes up your nose, it gets in the nasal patch of the cavity, and then it comes down, which explained the burning in the throat. It's like crawling, it's like a bug. And it works its way into my lung because I guess now the compromise is in the area of respiratory, the limited condition. It's not a bad from 9/11 because others got it worse than me, and I'm just a fighter in general. So I think I got a pretty good immune system. And once a doctor told me, my other doctor, before I consulted with Dr. Artamonov, when I heal quick, that means my liver is good. So I said I didn't understand his thinking, but he says you're a good healer, and that has to do with your liver and your immune system, and that's why I guess Doc is saying so. But I was very symptomatic, and there was no way because going on the respirator, I wasn't going to the hospital. I was taking my chances. I was talking with Doc every day. Doc was talking, get this, get that, whatever, and then I went through a bunch of stuff, and the immune builders and the Z-Pack. My other doctor put in for me, and you know, and doing the steamed salt water to breathe and clean. I was doing everything, and the vitamins and vitamin C. So I was symptomatic and very bad. I was bad. I sat right here in this room. I couldn't move, and it took so much energy to talk that I couldn't even talk with Doc. That Shiar talked with him. I couldn't talk. I'd get out of breath right away. Like a couple of words, and remember, I was like, you know, everybody was panicking, like, oh no, gotta save the chief. And let me tell you, it was a close call. So for a lot of folks out there that are listening, you're talking with Dr. Mikhail Artamonov. He's the Chief Medical Officer at Advocates for Disabled Americans, Veterans, Police, Firemen, and Families. Doc, tell us about your facility in Pennsylvania. He also, we have an office there with him. Tell us about your projects, you know, and then we'll get back to this. Tell them a little bit of your credentials. Let the people know who you are, what you're doing over there, and those the 32 beds and stuff. How we're trying to help veterans in crisis. What you know, a little of your credentials, so that they have a better understanding of why I call you an expert.
Well, Darren, you put me in a difficult position to present my credentials. But I'll tell you what, in a nutshell, all my life I basically spent trying to find the best what I can and in the different parts of the world and apply to my patient in different kinds of medicine. And I study everything from ethnobotanical medicine in Latin America, to acupuncture and to surgery. And there is no alternative medicine for me. I like the name good medicine. You just apply whatever is available. Doesn't matter if it's 4,000 year old or 1 year old. You apply what's the best and what's the safest. And that's important, what's the safest, because as we learn from these pandemics, sometimes main principle in medicine, do not harm, should be very important, because a lot of people die when we become too aggressive. So, so I practice the principle of good medicine, and the longer I practice, the more conservative I become. And that's exactly why our focus during this pandemics was on good, if you want to use the word alternative, but I would use word holistic, good medicine approach to strengthen immune system while being safe without compromising the people. And let me tell you something. Nothing is working 100% in medicine. But we know by now, after almost 12 months of this pandemics, that this approach to strengthen the immune system, to help people to understand how to prevent being severely symptomatic, is working much better with much less death behind that than any other approaches.
What can you tell us about, as a medical professional, about this injection that's coming out? What is that exactly? This vaccine. Tell us what this type of vaccine, to the layperson, that like when you got polio vaccine, and I had polio as a kid. We couldn't figure out how, but I had it. They actually inject you with the polio, right? When you
Yeah.
get those vaccines. So a vaccine for COVID would be actually injection with COVID, yes?
Well, again, I certainly am not expert in especially that spectrum of medicine. I'm not really interested in vaccination, even though it seems to be almost you're going to lose your license if you're not interested in vaccination. But I'll
Really?
tell you my opinion, my personal opinion,
Yes.
that probably doesn't reflect the formal medical establishment position. I don't think the vaccination is the way to go, especially with virus. It's just based on general understanding of what we know about viruses. They mutate very quickly. We can't, it's like flu is a good example. We're going to chase maybe 50-50 chances. Is it necessary to maybe give this vaccination to people in a vulnerable category? Maybe. However, again, after all these years of 30 plus years practicing medicine, again, we're learning do not harm. Can something like vaccine that requires years and years of testing become effective and safe after a few weeks? I don't think so. So that rush and that pace with vaccination, I think, can bring more dangers than safety. That's that's my point. So I would rather do vaccination by so-called vaccination by strengthening immune system, teaching my patients how to stay healthy, and if they get sick, how to stay mildly sick and get rid of the symptoms quicker rather than do vaccinations. And we
What
have established methods to do that. So for me, I don't see any reason to go for that extreme.
we're talking with Dr. Mikhail Artamonov, Dr. Mike, we like to call him, or Chief Mike. This is the article he's in, and he gives you a whole outline of his perspective on this disease and all diseases. And we're going to be doing more stories, and we're going to continue with Dr. Mike. We're here at Code Wind Talkers, coming to you live. We're live streaming off of Triple Vibe Radio. Code NYC, sunrise.com, and COVID19.mag. They're all behind this program, which comes to you with live talk, real talk, no hidden nonsense. This is not a social media broadcast. This is live, real talk with real people telling the truth. No games here. This is an informative talk show. It's real, it's live, it's truth, and we answer questions. We have guests that tell us what's going on. we focus around disabled veterans, disabled citizens, the state of our healthcare. Hence the reason for Dr. Mike being here, and also he's, like I said, the chief medical officer at Advocates for Disabled. You can go to www.adaadvocates.com, or you can follow me on Twitter. You all know I ran for Congress. It's Aquino #4 Congress at Twitter, and a lot of stuff I put up there. And we talk about this, so we're going to get back to talking about this in medicine and the approaches we want to take, because the topic of let's go into this area, Doc. Veterans killing themselves. How do you think? What do you think would be a good approach to deal with that, the psychological side, to help strengthen our veterans? I mean, I like your approach on how strengthen the body. How can we strengthen their psyche when they've gone through these traumatic war? It's war. War is traumatic. Johnny's a combat veteran. He was in one of the worst wars, and Johnny brought his cousin's body back home, who is 20 years old, killed in combat. A 20-year-old boy who went in at 18. Johnny brought his cousin home, and they were a close Italian family. 4 families lived together. They grew up like brothers. And we've seen how a lot of these Vietnam veterans, aside from the Agent Orange that they got sick from, maybe you could answer about Agent Orange and something about that to just enlighten people. We want you to share your expertise as a medical professional to enlighten some people on better approaches. So, Johnny, like that, I mean, every time I think of this story, and everybody knows this is his book, this is The Last Goodbye, where it tells this story. And if you want Last Goodbye, you can go to lastgoodbye.book.com.
Dashbook.com.
Dashbook.com. And we always talk about this, and you'll see the video and the story and a lot of other veterans. Not every veteran has a negative effect or winds up killing himself. Some cope better. Like, look at Johnny. I mean, he's the picture of health. He's strong, and he reaches out to other veterans. I wonder, and as an advocate myself, I had a veteran on the phone the other day. We won't say his name, but he was in an auto accident, and he was already disabled 80%, and they kept him in service. That shouldn't have been there. And Doc, we're going to have you talk with him and see what help you can offer him, because he's got some neck injuries, spinal injuries, and he had a TBI. He was in an explosion. Why he was still serving is beyond me. And this now, and I have to say this because we protect our veterans on this show. Doc helps veterans. I help veterans. Johnny helps veterans. And they just made you the Purple Heart Person of the Year, right, Johnny?
Honorary Veteran of the Year. Yeah,
Honorary Veteran of the Year. And that's up in where you live, right? Up there and there. So this is very important to us. It's very important to all of you. So it's important I say that. So this veteran was now kept, and now they want to make him AWOL if he doesn't turn over his medical information to the commanding officer. As an advocate, and the doctor would know, you don't give any medical information. For any of you folks out there, you're not required under the ADA to turn your medical evidence over to any adversary. It's the rule of law. Just because, and they try to bully people, you never have to give your medical, even in the court, in the United States District Court. The only one that can see it for validation is the judge, and it's called in camera. Okay, because the circumstance, the topic of a person fighting for their rights, that is debilitated. That record is there, but it remains private, because when you make court records, it exploits people's conditions. And I put a zipper on it. Zip, it's seen for the trial, and that's it. Nobody can maintain it, and don't let anybody tell you you have to surrender your medical information to them. So they're bullying him, and they're going to make him appear that he's AWOL so they can stop his benefits. I was already in touch with the senator. I called him. I got this call Friday night. I talked to Johnny about it. And you, the American people, need to know, we don't take this crap from anybody. You know, this is our country, we the people. And that's why we have cold wind talkers to share your thoughts here, your concerns. And if you having a crisis like this, and it's a funny thing because Johnny Pizza said, if there are any veterans out there in crisis, and I got the call Friday night, and I spent time in FaceTime, and Doc will be in touch with him, and we'll probably have him on the show. We're going to have him on. We'll see if he's up to it, and he's going to tell his story. So I want to get back to Doc, but I wanted you folks to know that we don't let anybody treat our disabled veterans or any vulnerable person like they did in New York. And that's going to be another question for Doc. Why would you put people with COVID into a vulnerable setting where all of the people in the nursing home are vulnerable? Because that's their to be in a nursing home, you got to be in a vulnerable state. So that move by the governor and a lot of governors around this country, in my opinion, that was an assault on the vulnerable, an assault, an outright assault, and an inappropriate act by an elected official to protect the people. Protecting and preserving the safety and welfare of the people is a very important factor that says, what were you thinking? You put people to death in nursing home by bringing sick people that had a killer disease virus in them, and then you subject the other people to harm without any sort of defense whatsoever. And as an advocate, I want to stop that and bring an action against that. And we're talking to our chief counsel about that because that's just despicable. My uncle was a victim in a nursing home and was neglected. And Dr. Mike, he was released to Dr. Mike. And it's all about the money. You see, and it's about bad practice, like Dr. Mike was talking. People, they've lost their integrity and character, and the people who suffered are these vulnerable folks and our families. Okay, I know lots of people that died from COVID, and there was a lot of bull crap about people. Everybody that got sick in a hospital because they got $32,000 a person, they made them COVID so that they get a check from the government. Again, our tax dollars hard at work in the pockets of people that don't deserve it. So I wanted to put that in because I wouldn't be the advocate I am if I didn't tell you the truth. And here we tell the truth, we tell it real, we tell it right. Dr. Mike,
I gotta say one.
yeah.
I gotta say one
Go
thing.
ahead.
I gotta say one thing. Okay, because you're talking. I get very annoyed. I get very annoyed at this. All right. A great example of what's going on in this country is the governor you're talking about, Cuomo, okay?
Andrew Cuomo.
Andrew Cuomo, right? He is getting an Emmy, okay, for his part in the COVID.
Yeah.
That is ridiculous. Okay,
That's absurd.
That should be stopped. Okay.
But you see, that's Hollywood playing a role, saying an award for his performance. That's exactly what he did. He performed. But in that task, here's what he did: committed high crimes and misdemeanors.
And
That's the logistical standpoint. People died from that. And Doc will agree. You don't. Here, listen. If you want apple pie, you don't throw oranges in. It's real simple. You don't put a bad apple with a fresh batch of fruit because eventually it's going to get and it's going to ruin all the fruit. So and some of our folks. And the other thing I want to say about that, and then we'll get back to the other topic because that's what this show's about, and that's why we're here to tell you the truth and give it to you straight. At Code Wind Talkers, there were veterans, homeless folks that fell victim, and they had these mass graves going on in New York because this panic and not telling the total truth. And these veterans got buried in mass graves without a final farewell. I'm not done with Cuomo yet. He better run for the hills because I'm coming with a lawsuit. I'm not wearing it today, but when I put it on, you're going to see me coming with it. And we can't tolerate that. They were buried. That their last bit of recognition of that final farewell with their flag draped casket, they were deprived of that. Somebody's going to answer for that. I want those bodies, and I want them to be buried where they're supposed to be. And that's the other. And that's what I'm going to say. And I'll turn it back to you. We'll go back to Doc, and we'll talk about some of, some other.
Doc, I have a question for you. It's just spinning around in my brain here. I read that you started out for 10 years, a decade. You practiced in Germany and Russia, not Russia, China. Now, when you were studying in China or research in China, did they put any red lights on you, or did they stop any kind of research and to tie your hands and any reason? I don't know if you can answer that. I don't want to put you on the spot, but
Oh no,
I'm
no,
just
Johnny.
curious.
Yeah, absolutely. So, well, first of all, um, I was in medical school after my military service. I'm not stranger to the army. I spent 2 years in Soviet army back in the days,
Is that
including
right?
including combat action. I have two medals from Soviet Union before it collapsed. So I certainly that's one of the reasons that I'm trying to help our fellow veterans, because I understand what they may go through, even though it's been a while. I was 18. So when I came from military service, I always was fascinated by Far East and philosophy and medicine. So I graduated at the same time from Moscow University, the Faculty of the Eastern Studies, and I spent 2 years in China studying. But it was back in 90s when the China was different. So at that time, there was almost no foreigners in the country. There was almost no cars, nothing like that. So of course, they let you do under supervision whatever you design to do, but nothing more than that. When last time I went to China was a few years ago, I was totally different country. So I guess your question, it really depends on the times. I'm sure if you now go to China and do some sort of research, they certainly will put limits on you as well. Uh, complicated, complicated.
Did you go there for studies 2 years ago to study further your studies?
Oh no, I was invited to actually become a chief of one of the major private hospitals in China, in Beijing, and I was getting my Chinese medical license. But then I decided not to go because I had too many patients here in the States, so I decided to stay. But that
Good
was interesting.
choice. Good
Yeah,
choice. Good choice.
otherwise I would know about COVID more than I know now.
Good choice. We're glad you made that choice. But now, what do you think about this systemic problem of mental illness that also affects our veterans? As you know, and I'm not ashamed to say, my son suffers from mental illness. So, this is real talk. So, what do you think about that? How will we tackle something like that?
Well, again, as I said, I mean, certainly there is a different layers of the problem, and I certainly understand at least part of that. I think it's more basic human response first of all. Like I think Confucius says one day that it's easy to hate and it's difficult to love, and that's how the whole scheme of things work. All good things are difficult to achieve, and bad things are very easy to get. So there is some different layers of this approach. One is a basic human layer. Are you strong enough? Do you have a core values? Are those values deep inside you? So when you see something that not is a part of your value, can you come back with the same core value, remain strong? Or your values are not that strong, and when you put in the circumstances that those values are being threatened by something else, can you stay strong or you'll change it? So that's one of the layers when you come back, obviously, from totally different environment. And we all know what's the difference in environment is. It's not just stress of the combat. It's different life, different responsibilities, different set of mentality when something is basically being done for you, you just following the orders. And when you come back to the peace, regardless how the peace looks, well, you have to take responsibility. Nobody's going to do it for you. And that's, in my mind, one of the largest stresses between and difference between the military life and the civilian life. Obviously, when you go to the combat like Johnny, you did, the stress is even more because you see things that you would never see in a civilian life. And that's certainly when you come back without any good adjustment process, what's going down first? well, that's your health, because we all produce our mental stress to the physical body, called somatization. Because it's much easier for me to have a headache or have PTSD rather than to remember those little kids that got killed in front of me. Do you follow me? So that's the reason for mental illnesses in the veterans, PTSD, anxiety, depression, substance abuse. We're all trying to dismiss that what we've seen because we cannot digest it properly, or it doesn't. This digestion doesn't fit our core values.
Right, right.
So that's what I think the problem is. It's not only society problem, it's more so in my mind human problem in general, more individual problem. Of course, society like Darren, I have the utmost respect for what he does all his life. He fights for those people who sometimes cannot fight them for themselves. And that's what the role of the society is, and I'm proud and honored to be part of that. But again, at the end of the days, in my opinion, it's more your core value and how you react to that.
What about this? Like my uncle, and they gave it to my son too. Let's talk about one of these drugs they use for it, because I like your approach. How would we build this Risperdal? This Risperdal, that's a very powerful drug, right? A psychotropic drug. That's very powerful. They make my uncle take. Well, she just reduced him at the VA. That's why I want you to sit and talk with him, because I like your approach, and you could set him on a different path. You know, we could do FaceTimes with him, and you know, you do that audio uh, appointment, and because he's a sweet person. My son, they gave this Risperdal. This has a horrible effect on you. It gives tremors, and then they give you another pill to stop the tremors. My son, he gets the twitch, and they didn't give him another one, and then he stopped because he doesn't want to take it, and then he's let me just share some of the effect. Then they get like violent statements, you know, like hateful statements come out, like a lot of anger, a lot of repressed anger, probably from the divorce, um, early divorce, because he was young. He did have some drug use, and one doctor said, well, that caused the chemical imbalance, and that made him this way. I tried to. Why is Risperdal a drug for this mental condition? What do they hope to achieve with it?
Well, the Risperdal belongs to the group of so-called antipsychotics.
Right.
And as an ex-shrink, I spent several years in psychiatry, including psychotherapy practice in Germany. Um, you know, do we really want to go that deep? But it's interesting. I'll give you just my perspective. I was trained as a more psychotherapy part of psychiatry. We used to laugh at so-called biological psychiatry, meaning psychiatrists who believe that everything is done through the chemistry, including medications. And that's what the major school of psychiatry right now in the world is. Psychiatrists don't talk anymore. They just prescribe medication. If you want to talk, you go see psychologists. Used to be totally opposite. Psychiatrist is a person who deal with psyche. Psyche is a soul in Latin. How you treat soul with the medications, right? It's certainly safer and probably faster and almost no-brainer to prescribe pharmaceutical rather than try to get, to the root of the problem. And Risperdal is a great example. It's not a bad medication. It's the way we use it.
Hmm. Hmm. And what did I what is the purpose of Risperdal? What is it supposed to do for you?
Well, again, as I said, it belongs to the group of antipsychotics. So the psychosis is a change of your perception, so to say, when at some circumstances you can present the danger to others, danger to yourself.
Right.
So that's kind of the extreme of psychosis. So we as a doctors trying to bring that person back to our normal perception and certainly try to make it safer for others, for society, for the person that himself or herself, and that's what the purpose of the Risperdal is: to bring your symptoms back to what we count as normal perception.
Okay.
It's a deep philosophical question about psychiatry in general and psychosis in particular.
Well, because it's the systemic problem that our elected officials like to talk about. They talk about mental illness, but they don't address it appropriately, as we know. I try and handle it. I mean, just talking like like psychiatrists used to talk to you, to find the root, the cause of this problem that's in you, to make you think this outburst of anger. I get that, but when people hear voices that's like schizophrenic, how does that how does how is that caused? I mean, like people say, like we want people to know, to get this an information show, like what causes hearing voices, and whatever cases that you found, like that you found something you can give us to chew on, like what causes a person to hear voices that they believe they hear them. What's one of the causes you may have found in your studies as a psychiatrist?
Well, the brief answer, we don't know. We still
Okay.
don't know. Okay, there's something happened somewhere in the brain, maybe beyond the brain, that kind of changes that normal electromagnetic functioning of the brain as an organ, and there is a different theories behind that. Anywhere from biological rhythms, seasonal changes in our electromagnetic perception and existence under the sun, all the way down to the pre-existing conditions such as trauma, PTSD, and so on and so forth. But after 200 years of dealing with psychosis, we in medicine still don't know. There is a tons of literature available, but we don't know. Otherwise, there would be no issue with Risperdal. We would just cure it. It's the same. It reminds me about our initial conversation on COVID. There is no approved treatment. Why? Because we don't know. If it was that easy, if there was a virus, then we can come up with antiviral treatment, kill it, problem is solved. The same with psychosis. If we knew what causing psychosis, then we'll fix it. But we don't know. And that's the major problem.
So that's what they do. They just the medication is a band-aid.
It's a symptomatic treatment, correct. It's a
A band-aid.
band-aid on the symptoms that beyond or outside of our box, what we consider it to be normal.
To reduce the symptom behavior out there, like they're angry or agitated.
And as you know,
Take the pill.
Darren, psychiatry was one of the few areas in medicine that used for political, issues, and that's exactly why. Why? Because there is very easy to label somebody being outside of the box that
Right.
Perceived as normal. So that's exactly why it's
Have
easy
you
to change.
have you had any success with some sort of holistic or other of your skills with people that had psychotic issues?
Well, currently, I don't deal with major psychiatric disorders like psychosis, so I can't really answer that question. But I know from literature, but there is enough attempts and successful attempts to treat that. However, nothing been really set in stone that universal treatment. So that's exactly why we
It's
don't
really
know
pretty much case by case, right? It's always case by case.
Do you
unless we know how to fix it.
do you
Right.
think
Don't.
do you
Go
think
ahead,
that
John.
I have a personal interest in this because my daughter has a problem with schizophrenia. Do you think it could be generic? Because I had a problem with her mother, my first wife. Now, my daughter, she's living with me now. She's doing great now. She was hearing things, hearing voices, thinking people were watching her. That they had cameras in the TV and in the
My son
computer.
does the same thing.
Yeah.
Same thing.
That she thought that the light bulb in the light had a camera on it. The screw that was holding the light on had a camera in it. Okay, she wants. I'm going back now. It started about 15 years ago when this first started.
Delusional stuff.
Yeah, she thought everybody was watching her. So I went down and I said, and I told her, look, you're gonna have to go for help, because this is right. And so we took her for help, which it would help her, helped her a lot, right? But she had another recent episode of it. Now, at 15 years ago, she got in her car. Now, she never traveled in Manhattan. Okay, she got in her car. She drove downtown Manhattan, went into a what do you call it? Hotel. Okay, went up to the guy at the desk, and he said, "What can I do for you?" And she said, "I'm here. Just I got a date with Derek Jeter."
Oh,
Okay.
Jesus.
Okay?
My son does the same thing.
All right.
He mentions these famous girls.
Okay. So now we had to go. My brother-in-law had to go down there, take care of go. She had a car with her. I mean, she never went to Manhattan. Here she is going down Manhattan all by herself and doing it. So she's here now. She's doing really good. She's very good, you know. But the medication puts so much weight on you, which doesn't help the matters any, especially with a girl, you know, who's been a beautiful girl all her life.
Doc, I got a question because we're talking about this. My son going through the same exact thing, and they inflate themselves. I think that's because they feel some kind of separation, so they pick high-profile figures because they feel unaccepted in society. That's just my opinion. But my son, what's the effect if you drastically stop and not take the medicine, this Risperdal? What happens then? Like my son's not doing. He just
Well,
stopped.
Interesting. Let me step back a little bit. What Johnny was saying, the sad story about his daughter. Well, it's a good story because she's doing well now. So, it's interesting enough, but if you look at the symptoms of, let's say, psychosis as an example, right? Or whatever it is, delusions. See, there is a absolutely different causes may lead to the same symptom. For example, well, if person has liver insufficiency and getting toxic from those toxic products that liver cannot metabolize, called encephalopathy, they develop problem. If the person get infected with certain pathogens and get high fever and it attacks the brain, they can develop the same symptoms. Can they develop the same symptoms without what we understand would be the cause of that? Yes. So we have that entity, kind of the symptom that may be caused by totally different reasoning. Does it say that psychosis that we treat with Risperdal, does it mean that we just didn't find the reason for that? There is some data from Germany actually that they testing in a lab for certain type of viruses in schizophrenia with a very high probability and connection between the test being positive for virus and development of the psychosis, which brings me again back to my original explanation and difference between biological psychiatry that believes that everything is caused by the physical changes and need to be treated by physics or chemistry mostly, and psychiatry from coming from the the soul perspective, that everything is treated by the talking to people or maybe getting back to the deep issues and so on and so forth. I'll tell you what, my journey was actually towards the biological psychiatry. I do believe now that a lot of symptoms that we traditionally consider mental, meaning that stress, whatever, is actually we didn't find the physical cause for that. And by physical cause, I mean some toxicity, some infection, something like that that we didn't look hard enough to find. And I believe that actually their portion, that's my personal belief, that the portion of really true mental illnesses is really small. What I mean by true mental illnesses, that's something that is not caused by identifiable physical factor. I think the more we develop this testing, the more we look into inside the body, how the body works, and establish that mind-body connection that everybody's talking about. It works both ways. Our psyche is very strong. So when it goes down, you have to look at the body first. Meaning that you have to identify or try to identify those conditions first before dumping Risperdal. Do you follow me where I'm coming from?
Yeah. So you're saying that there could be a physical breakdown that's causing the mental.
Correct. Let's say I see a lot of patients with Lyme disease, a chronic Lyme, that traditional establishment, didn't even believe and still don't believe that it does exist, even though it's a huge pandemic in the country before before COVID, that was probably the largest pandemic
Pharmacy.
besides
Yeah,
the
I know
flu.
people that had it. I know people that had it, and it
Exactly.
goes out to all
And
kinds of.
they present with the symptoms of so-called neuroline. It's depression, it's anxiety, it's some psychosis sometimes. What it is? Well, we have to find out. And when we treat it appropriately, the appropriateness is a different definition. But when we
Yeah.
treat it causatively, meaning we address and find the reason for that, they get better. All these psychotic symptoms, major psychiatry symptoms, get better and quick.
Yeah, yeah, that's a good. I never thought about it from that perspective. Even as an advocate, I address, like I said, the people that can't fight for themselves, and being a person who has fought civil cases, taught myself the law to learn, and how to cross that threshold into the signs and symptoms, and then be the voice of that and put that together with the logistics to have a successful outcome, because these folks that needed benefits and they had conditions that the unseen condition, and this has always been the problem, like somebody has a handicap placard and they park in their spot and the person sees them get out of the car and they don't see a cane or something, they're assuming they're not entitled to that plaque and they're using it. They don't know, because it's the unseen. Mental is unseen sometimes. They're like dyslexia. There were different mental effects, as I know and learning signs and symptoms to defend them. I had to defend many times how it affected their major life activity to prevent them to be gainfully employed, that it would last, more than a substantial period where they couldn't be gainfully employed. So, I mean, I became a pretty smart guy from being passionate to a subject that matters in our society, right? Remember before they call you disabled or they wouldn't call you, but in this pandemic, we became vulnerable. We're the vulnerable population now. And still, because we're on that subject, we still don't get the equalities we're supposed to. We get written off as, okay, even in the practices of everyday society, voting. Disabled voters didn't have the same access. I've been fighting that since 2014. They still don't have the appropriate access, and there are federal mandates in place. It's like this medicine, if you don't have, you don't get. You know what I mean? So, it makes a little sense what you're saying. Some of it could be the biological condition that could, it's like they had those the what was that disease years back? Somebody get it and they go nuts from it, right? They catch some kind of disease and it made them go crazy. Back in the early days, right? Like when Al Capone got syphilis, it made him go crazy, right?
That's exactly a good
It's,
example. It's a great
yeah,
example.
that's why I was thinking that when you said, oh, no, so like, you know, how does that make you go crazy? It was kind of bug. I mean, like syphilis, a sexual transmitted disease, makes you go mentally ill. He went nuts and lost his mind.
And
Imagine.
of course, Darren, Johnny mentioned that there is a lot of actually literature. I mean, you have to understand that thousands and thousands and thousands of scientists working on those problems every year and every day. So there is enough evidence that there is some genetic component, there is some epigenetic component, but generally in medicine, we come into consensus that despite what we thought years ago,
Right.
that everything is, so at least half of it is genetics, the actually genetic causation is very little. It's very few diseases, very rare diseases that caused directly by genetics. Most of it is caused by combination of some sort of genetical vulnerability and weakness and your choices in life. We call it epigenetics. Well, you would say that, hey, it changes human mentality. If we realize that and we think about that, it's the same as the difference between military mentality and civilian mentality. If your disease is caused by epigenetics, meaning by your choices in life, it should make you stronger. Why? Because you have ability to change it. The same, it, it reminds me about civilian life when they're coming from military service, responsibility is on you. While being in the military, it's almost you blame genetics, you blame the circumstances, you're following the orders, and that's the difference. But we know in medicine now that majority of diseases are actually largely influenced by epigenetic factors, meaning environment, meaning your choices in life. So that's really interesting part. It's a philosophy in medicine.
The funny thing, like John said, and now see, when somebody says something to me, it hits a trigger, it sets off that light. His daughter said she's going to meet Derek Jeter. The other night, my son called me. He says he's with Jennifer Aniston. They're getting married.
Oh, really?
Oh God, I don't mean to laugh,
No, I
but
know.
you know what I'm saying. It's our kids, and I feel exactly what you're saying. When he had his meds, it's the perfect son. Perfect son. He's helping you. He go help the lady. If he sees an old woman carrying a bag, he'll run down. Let me help you. But without these meds, he's out of his mind.
Yeah.
He's calling me. Yeah, Katy Perry's calling me. She's bothering me. You don't understand. I'm going. I'm working with the government now, and it's so many delusions. And then there's anger in it. Then he'll call his sister, threatening and demanding money, calling me, and then he sends pics of his anatomy, and he send them, to Shihar and stuff. I mean, it's horrible. You
Yeah.
can't. I know what you went through. Imagine a boy, and the extreme he goes to. I worry more about his safety from his behavior, that somebody don't know. I mean, I had to go out because four guys jumped him. I had to go and defend him. I had to go out with, go old school on him. Came around the corner and grabbed these four guys, and they beat him. He got away. And you see your child, no matter how big they are, you remember them as a baby and a good baby. And he had red mark on his face. He got away from them. They would have beat the hell out of him. And that's my concern as an advocate. How do we save these folks? They're dying. They're getting killed. Cops are killing themselves. Veterans are killing themselves. They're feeling. How can we approach this and be successful? Help them see that they're not these things that they feel. That's what I'd like to see. That's what I hope to accomplish with Doc. I hope to accomplish that with you, because I think it's a lot of Q&A and a lot of thought where if we really pay attention and we become the guys that ask the questions and try and come up with a result more positive than some, more than writing a prescription, because there is a core depth inside of them that made them, I believe that, what he's delusional, and he expands on it to stress that upon me, that like, okay, I'm with Katy Perry of notoriety, or I'm with Jennifer Aniston. They want to make you believe that they're of value. That statement says to me they're lacking self-esteem. So that's why they give you a puffed up name. But when they do it in a strange place to a total stranger, I guess it's the same thing, but that person doesn't know their background, so they want to impress them. I'm here to meet them, but there's nobody there that's going to meet them. I mean, how did they separate from that actual reality? That is so. I still look at that. I mean, when they show up to a saying it to me or saying to the parent, I get that. You know, that's workable. He could be exaggerating. But when they go to a total stranger and they believe that they're here to meet somebody, that's where I just like scratch my head and I defer to medical professionals.
Yeah, but I think what's important is like you and I have this, we have similar experience going through, right?
Oh God, yes.
When before she came to live with me, she went to the hospital. Someone had taken her to the hospital, and we heard her on the phone, and she was like, I told her when she came here, I said, look, I was ready to call a priest to perform an exorcism. That's how bad it was. The cursing, the way she was talking, it wasn't her. It was a different person. It was like the devil came out. A demon was in her. You know what I'm saying?
Yeah, it's
But
scary.
now that
I
she's
had to have
with
the
me,
cops at the house for Eric. They had to come and put the handcuffs, and I
that's
said,
what I'm saying.
"Stop! Don't fight. You got to
But
just
now
to get him the treatment."
yeah, but she's home with me now because I raised her since she was a baby, and I'm her comfort zone, and we talk, we talk, and she gets up in the morning, makes my breakfast, helps my wife, cleans up everything. She's perfect, perfect. You know what I mean?
Yeah,
But
Eric was like that. Eric
she
was
was
like
she
that
was in a dark place, and luckily we brought her out of it. You know what I'm saying?
for
And
you.
when I told her about me getting a priest to perform an exorcism, she laughed. She thought it was, she laughed. She has a very great sense of humor. You know what I'm saying?
Yeah.
So I think talking to them and really, you know, when I first went to a psychiatrist for my first wife, way back in I was still in the army, 1968, right? It was in Jersey, and I'm sitting at with the doctor, and we're talking, and the first thing he does, maybe 15 minutes, and the first thing he does goes like this, and I'm saying to myself, this guy is looking at the time, okay, when his next customer is going to come in, or patient, whatever you want to call him. And that gave me a bad taste for psychiatrists, okay?
Yeah.
Because to me, they were only interested in the next buck they were going to make, not
Some
listening.
people have bad bedside manner. They
You know what I'm saying? You know,
sure.
that's the kind of stuff that turns people off. And even the patient could see that. You know what I'm saying?
Sure,
This,
sure you
this
can
guy
see
ain't
that.
interested in what I'm
That's
saying.
real.
He's interested in the time going by, you know?
Well, you see, that's why doctors like Dr. Mike, and that's why we like professionals, people who have a good and fresh and genuine approach and care about our humanity. Dr. Mike, as I call him, Chief Mike, he cares about people, and that's why we had him on this show, because I wanted
That's
people to
different. That
see.
makes a big difference.
Well, it makes a big difference. That's why he's on the cover of this magazine, and that's coming out. And you're going to see updated story, and we're going to try and do this monthly. And with COVID, look at how we all are separated. Generally, I would be in the room. We're coming to you. We're Cold Wind Talkers live, put on through Triple Vibe Radio. I'm Darren Aquino, Johnny Frantangelo, and Dr. Mikhail. On I just had like a sharp pain. I've been getting that lately with the sinus. No, for real. It gives me it's been bothering me here. I've been getting a pain, and I thought it was the muscle. But every morning I'm waking up and I'm feeling this pain right here. And it feels like this muscle here, but it's in my ear too now. So, and then I just got it now when I went and I moved it and it shot up. It's like a brain freeze almost. And that's why I went, and so anyway, so yeah, so that's why, we talk about on this show, we talk in this magazine, and this project here is about people. And we're bringing people to meet other people so that doctors like Mike, okay, and veterans like you, and advocates like me could make a difference in the lives that need a hand up and not a handout. And that's always been a challenge because, in our society, we've become so plastic and so shallow that it meant more to how much you have determined who you are, and that's not the truth. You know, the best and greatest people I met were the ones that had the least, and they give so much more back to community and society, and they're not interested in wealth or fame or notoriety. They're just peaceful souls. And I learned a lot from folks like that. And let me tell you, I helped a lot of folks that were disabled. Not all of them, some of them were wealthy, and they just couldn't navigate to get the services they needed. And as an advocate, when somebody needs Dr. Mike, I advocate them to him and him to them and bring them together like this show. This show brings people together and it gives them a forum. Sometimes I find that a forum sometimes is the answer for some people. A forum is the answer. So, I'm happy the doc is here, the chief, we're doing live radio and television. We're, I think, in 78 countries right now. And people are hearing everything that we're saying. And I hope, this is Code Wind Talkers. And all of us, Johnny Pizza, Dr. Mike, I'm Darren Aquino. We're making sure if I keep going through everybody's whole name, we'll lose most of the time of the show. So this is a show that takes an approach at a circumstance that becomes a challenge in your life where maybe you just need to vent. Another day, Johnny said the other day, because I don't know what our time is. I didn't get any signals up yet. So they're letting us run over. That's good. People must like what we're saying. They like our brilliant doctor here sharing his, I like his holistic approach too, because I think working on the strengthening of the immune is good. And we got so many folks out there that need an avenue to go to. They need somebody to talk to. If it's another veteran comrade that can relate to today's combat, to your combat yesterday. You know, war is war. Time frame may be different, but when you engage and you have to kill someone, Doc, I didn't even know you was in the army. You never told me. I didn't even know that. Thank you for your service. Thank you for your courage. You know, I know it's over there, but you know, soldiers are soldiers. Even soldiers back then, they respected each other as soldiers. You know, they were put to that place by the leaders of these countries, but they were human beings, and they came up with these codes and things, and what they call that when you say the Geneva Convention and all these things. If you got held under the Geneva Convention, I ain't telling you nothing.
Rules of engagement.
Rules of engagement. So today, you know, imagine Doc. So he knows firsthand as well, and the veterans. So that's a problem I want to address more. I want to look into the mental illness, and I know, if we get a doc and we talk to Doc all the time, we want to take ADA to another level of more operation instead of just facilitating this one to that one, but actually be the people responsible for the facility that's going to provide it. Because the way Doc thinks, I think, you think, you know, I'd like to see these veterans with this problem, not so much on a one-on-one, unless they feel, but I'd like to see an approach. And I said this uh, to the mayor in New York when the police were killing themselves. And that's another thing that we need to resolve. These folks, when they die from this mental illness, which then becomes a line of duty injury, they don't get any benefits. When somebody kills himself from a stressful job, from hurting a kid or doing something where they were forced to do it by their job, and they kill themselves and they don't get a benefit, I have a problem with that because it's job related. And for that time, they didn't know it. And I said this, listen, we can make a case on it. But my lawyer says, Darren, you know what? I never looked at it that way. And that's what it is. See, like Doc, he says, we're looking at this approach. He's looking at what other doctors don't look at, and he's having great success. Doctors, like we know, my brother used to say, uh, opinions are like assholes. Everybody's got one, you know. But the reality is it's the approach, and that opinion was appropriate for that individual. Doc has had success and seen it, and then it makes you explore. You know, I like Doc's method because it goes into depth. He wants to find a solution, not a band-aid, because you know you got to change the band-aid. So working with somebody and being more involved, like an advocate, if we get more docs like Doc, like Dr. Mike, you know, I think we can solve a lot more of our problems. He said in the beginning, not everybody's looking at what they're supposed to look at. It's new human nature. You know what I mean? And sometimes these puffed up folks, they into a place and they become lazy, like lawyers, like some lawyers. You know what I mean? They get so much that they don't try a case. They don't have the same passion for the thing that they thought was a horrendous action, and they went and fought to the highest court. Now they don't see that same situation that bad, and I wonder. And I've said this to lots of lawyers. What happened? Your character? You got a character flaw now? You don't feel the same passion? I mean, I do what I do, and I'm very passionate about it. And I just know I did 11 cases. I'm getting ready to do 12, and I'm going to take them down like Judy Brown because the passion I have and the logistic is, you know, when you fight a case, it's the story with statutes. You know, Jones versus Jones. You know what I mean? That makes the association to give me the threshold into district court that there has to be a constitutional question. And with this other veteran that we got and my uncle, he was abused there, and they took off his testicle. We don't know why. So when we get those other tests, I want you to review some of these medicals that we get from him. They still didn't give me the record. We got some, but I'll send them to you, Doc, when I get them, so you could go through them. They did something bad there. We don't know what. We don't know why. And here's what happens to that person that they say, and here's what their cover-up was. Sound good, guys? Let me know when you are ready to end. Okay, we'll do it. We'll do it in 5 or 10. So, here they say he's mentally incompetent, and Doc knows this story because he communicated so we can get him out quicker. And all they concerned about Medicare, Medicaid, his pension check, and his Social Security that they were taking, and they sent him home with holes in his sneakers, They didn't test him before he left. I asked the doctor. The doctor comes out. I have the bills on the table. She's billing him every day for 25 minutes, and she sees him once a month. I'm going to bring that in court. That's your tax dollars. That's your tax dollars. That's my tax dollars. Here's the bill 25 minutes every day. She sees him once a month. Where'd this come from? They panicked. So, but here, he's mentally incompetent. He authorizes them to remove his testicle. How did he do that if he was mentally incompetent when I'm his guardian on record? Why wasn't I called and informed? Why wasn't he given the right to another opinion? Hey, he got an infection. We don't know how. They cover it up. And this is why people think, this is why lawsuits come out. You understand? You got to shut down facilities like that. They got to be shut down. But here's what happens. Somebody else bought the facility. They allowed that practice, and they're trying to say to me, well, we don't know that. We're going to return this money. He didn't get it. And then they said, oh, I can't return that money to you at Riverdale Nursing Home. Riverdale Nursing Home is a whole. Okay, we have to close down nursing homes that don't provide. A nursing home is not a medical facility, but it should be a facility that nurses their condition and have more periodic checks. That he was left 6 weeks, he told me. He accounts for it. So they try and make him delusional. The doctor at the VA reduced his Risperdal to 1 milligram. She says, no, just give it to him at night. She had a little conversation with him. We were sitting there. She had, how do you feel like this? She spoke Spanish to him. He responded. She says, reduce this because this is a very strong drug. And he doesn't appear to be this way. But now the VA wants somebody to be his custodian. I said, why he can't be his own custodian? Well, the record says, I don't care what the record says, okay? And you're going by old medical. Now, one person is not supposed to know what the other person is doing. And when it comes to medical, they can't use it against you. And then they want to do an investigation on me so that they could dig in so you can't fight them, so that they could have something against you. It's a protocol. So I told my cousin to step up for my uncle. I says, you'll be his fiduciary because I'm going to sue them. I'm going to sue the VA. Okay? I'm going to sue them because then all of a sudden they'll take something. I had bad credit in this year, and that's why I don't give them anything on me. They're not entitled to it. You know what I mean? And that's what they try and do because they want to do the scrutiny on me and everybody associated with me. How come you didn't do it to the nursing home? Now you want to do it. You let it go for 3 years. You let them take his pension. You let them bill Medicare. And you people want to tell me this? Now it's time for counsel, and then Doc will look at his medical, and we'll see, what other approaches holistically, because they said he has a little murmur in the VA, and they did a sonogram, ultrasound around his scrotum, because we don't know if there was testicle cancer. We don't know, and they gave me no medical when he left, nothing, and they want him to see a doctor. Okay, where's his medical? Give it to me. You're a nursing facility. You're not a hospital. You sent for his records. They had a person get his records without asking me. So they changed his proxy so they could alter his record. It's like a criminal empire. That's why nursing homes, I would like to see, and I'd like Doc to work with me on that, like, either taking over some of these facilities, having a doc like Doc, he looks and sees. You know good care from bad care. Care that's needed when it's needed. So when we go into a place and we look at it, we get a court order and take it over. They're incompetent. They put people at risk. As an advocate, I could do that. Take it over. Make the state give it to us, over to our leadership. And then we could also bill them for it. Okay? But people deserve good medical care, especially in their golden years. And they're not getting it. Cuomo likes to murder them. Okay, let's put sick people with them. They'll be infected, out of sight, out of mind. That's what he did to thousands of New Yorkers in nursing homes when he infected them with COVID. He did that. Him, the mayor, and the governor and the senator, Chucky Schumer, allowed it. Their federal rights and their local rights were not protected. It was open season on the vulnerable. So we have to stop that. So we'll have a couple more comments, and then we'll wrap it up. We had a great show. Let me just show you. We're here, Cold Wind Talkers. We're going to do some holiday. I love to cook. I made a tray of lasagna. And tonight, I always like to give something. I'm going to make a cookie. Can you see that? Can you see that? That's going to be on a gingerbread house. This is the gingerbread. I got to build the house, and it comes with a pastry. I got to fill up. This I'm going to line it up, make the pastry, and it's got the little snow and sprinkles. So as we begin tomorrow, I'll be making a 25-pound turkey. I'm making a ham. I made the lasagna today. I didn't want to wait. I'm gonna put all kinds of potatoes and greens, and it's gonna be. I wish you were here, Doc. You got to taste how I cook. You got to
You
be here.
make me hungry. Stop.
You got to be here. Johnny knows. We'd have a big party, but we're all gonna get together. We're all gonna be together, and as soon as we get past this, these shows are gonna be live. We're gonna be sitting in a studio, perhaps, and this is gonna be no less than Jimmy Kimmel. But the thing is we're gonna be talking to real people. This is not about celebrities. This is about real people with real issues telling their story, us listening and sharing the story, because this is the forum of the people, for the people, to hear about our veterans, to hear about medical professionals like Doc who are out there trying to be an answer, a solution to the problem. Those voices now are being neglected. We're coming up with solutions and we're being pushed aside. Pushed aside. This is our country, not their country. They work for us, we don't work for them. Here at Code Wind Talkers, we talk to people. And we're here to support you, lift you up, and help you in your challenge. Again, this is Code Wind Talkers. I'm Darren Aquino. This is Johnny Frantangelo. And this is Dr. Mike, baby. Remember, Dr. Mike. That's what you got to remember. Now, you can go to the website. Dr. Mike is there if you need medical attention and you're in the area. Before we close the show, Doc will give you his name and anything. If you have any medical concerns and you're in his area or you want to reach out for his expertise in the fields of his practice, I highly recommend him. He is held in high regard at Advocates for Disabled. He puts his heart and soul into humanity because he's there to make a difference. And that's what this show's about, making a difference in your life, and maybe you'll pass that along. That's what I call paying it forward. And Johnny, what else do you want to talk about? And then Doc will give us a little information so people can get them, and then we'll thank our sponsors who helped us. And I'll get my little pastry ready maker because I'm going to be out there making gingerbread. I'm heating the lasagna. I'm going to have a big lunch, a glass of wine, and I'm going to sit down and celebrate. Today was a good show. Tomorrow's Thanksgiving. I'm thankful for you guys. I'm thankful for Code Magazine. I'm thankful for Triple Vibe Radio. I'm thankful for everybody. Carl Van Nevius the third, for helping us put this. I'm one of the executive producers here because I wanted a forum, and Carl put the name together because Johnny, and my mission, Johnny Pizza, is the veteran. It was going to be, when I created this show, it was just going to be a podcast about me talking to all different people. But I thought it would be better if I had a co-host that can relate to today's veteran with the war on terror. Johnny was in a war on terror, and he had to bring home his cousin's body at 20 years old. And you folks need to read this book, The Last Goodbye. You got to see the content of this book. You're seeing the man, and here's his story. And it's an incredible book about for people that can see it. There's what Johnny looked like over there. He was a muscle-bound 19-year-old patriot that went under the instructions of the commander-in-chief to help defend Vietnam and bring it into democracy. And over 50,000 men died. It was a tragedy. And a lot of them folks had Agent Orange. I knew my sister's boyfriend died from it when he returned. These were the older kids. I grew up in the 60s. And, it's just tragic. And we can't overlook our veterans. They're the core of this. And I lost you, John?
I'm here. Yeah.
Okay, I lost your picture. So we're going to get, okay, there you are. So we're going to get ready to wrap it up, and I'll let you say a few words. And then, Doc, I want you to tell people where they can reach you, your website, how they can come and see you personally, how they can have a personal thing with you. You can always go to www.adaadvocates.com and find out about advocating. And Doc is a medical professional, MD, PhD, and, he's there to help you, questions, concerns, you reach it, and that's it. If it's medical help that you need, or an advocate that you need, or you just need a place to talk where somebody's going to listen, that's here at Code Wind Talkers. Again, I'm Darren Aquino. I'm going to kick it over to Johnny Pizza because I got to get ready because I'm going to make some good food tonight. Very good food tonight and
All
tomorrow.
right, shut up already. Shut your mouth.
Go ahead.
No, anyway, I want to thank everybody. Thank you, Dr. Mike. I really appreciate you coming on. Thank everybody. I want to wish everybody happy Thanksgiving. Thank our veterans for letting this possible that we can have a free and safe Thanksgiving. God bless everybody. And I thank God for having brought this amazing people into my life. Thank you so much. God bless you, Doc.
Dr. Mike, baby, take it away.
If I may, last 2 minutes, gentlemen. First of all, happy Thanksgiving, everyone. But I was listening to you, both of you, and I'm honored to be in such company. So Darren called it being passionate about something. That's what makes the difference. The word enthusiasm is coming from Latin entheos, meaning with God. And that's what makes the difference. The more man meditates upon the good thoughts, the better will be his world and the world at large. And that's what I'd like to finish because that makes the difference. Not the science, but your motivation and love. And that's what I love about you, gentlemen. We're trying to make a difference. You're amazing people. Enjoy Thanksgiving. Have a blast with your family, and we'll hopefully meet soon again.
Now, Doc, why don't you give somebody a website where they can get you if they have some concerns and they want to hear about your holistic and stuff like that, some kind of treatments, because I know you deal with spinal stuff and things like that.
Well, I'm sure, Darren, they can find me as far as the veterans. They can find me through your website, through our website on ADA. My practice website is mjahealthcare.com. But again, the major work with the disabled veterans and policemen and the families are done through Darren's foundation. He is great in that, and you can find me if needed.
And just so everybody knows, we're going to be redoing and revamping the website. I was so busy campaigning, and we wanted, because we're going to another level and more involvement with the people, because what ADA does is help you maintain your independence. The Americans with Disabilities Act was a law to maintain the independence of an individual. So I made the site pretty liberal. But now, after recent and after COVID, I got to make it more detailed. I got to clean it up a little bit. I made it more as an information window. I wanted people to feel independent. I put information there that other people would take and use to profiteer on. And that's just wrong. So we're going to put a whole new format, a whole new phase where you have to log in, become a member, and then you could ask questions to Dr. Mike. We're gonna fix it up. It'll be state of the art. Excuse me. Doc, I think I'll have to call you later. I think I need to. And
I think you need a sleeping pill.
But I was so excited today because this is, we got to have Doc on the show, and he's such a good human being. So he has a direction. He cares about people. He's motivated by the challenge you face to help you overcome it. That's a good doctor to me. And the people that are in my life, the doctors, they're either my friend or they're somebody else's doctor. They ain't mine. That's for sure. So I surround myself with good people. I'm honored to be in this company. Doc is going to come back and see us again, and he'll give us updates, and then you'll read about Doc. The articles are already out there on the magazines at codnyc.com, sunrise-88.com, and of course, our newest project and the one that's going to be more informative on healthcare. And Doc is the main contributor to this. He's a partner to it to bring and enlighten, citizens around the world. We don't know where the magazine will go. We know it's going to be in the United States, but information is the true knowledge and power to a successful and healthy life. And if we get to do that, it's contributors like my co-host and our special guest. So I want to thank everybody today. And to Code Magazine, thank you. To Triple Vibe Radio, thank you.
Thanks, Sean.
And don't forget, you know how to get Doc. You know how to see the new thing. And we will be working. And Doc told me Now that he's a veteran, I gotta say this now, because we're talking about we're gonna have to go with somebody else. Netflix is on Twitter now, and we don't like how they're talking, so we'll find somebody else. Maybe we'll go with the History Channel. We're doing this military movie on Johnny's life, and we hope to make it a mini series. And I told Doc, you're gonna act, and then he told me that he was acting when he was young. But here's the good thing: he was also in the military. This is gonna be like a no-brainer for him. He'll play a high-ranking military officer because back in that day, Russia was there, and there was some stuff with Vietnam. So the research, I was just a baby. So not
Darren,
like
and I
this.
still have a good accent for the movie, you know.
I
still
know.
have a good accent.
I'm telling you, we're gonna have a blast, and we're gonna do that, and we're gonna put one of the things that I did as an actor and still do is I make a doorway for disabled actors to get fair and equal access, something that wasn't a practice. I started it in 2001. The union wasn't supporting the actors, so I went to the casting directors, and then I went to the production companies, and they said, Darren, that's like a no-brainer. Okay, we'll do it. I said it would be better for continuity instead of somebody making believe they belong in a wheelchair or they're blind. We have actual people who got union cards from little things that they could use them. Why not? We're in a society today where there's 150 million disabled Americans nationwide. You can't give that person an opportunity to gainfully earn by just doing a walk by or background. Of course you can. It's a matter of choice. And I didn't like theirs, and we're going to change their choice, and we're going to do it in our own project. So we got these two projects coming out. The Last Goodbye, and you're going to see Doctor in his acting career as he comes back as an actor.
Your
in
name,
The Last
your name,
Goodbye.
your name is changed to Dr. Katz.
Dr. Katz.
If you read the book, you'll know what I'm talking about.
Yeah. So that's it, man. And happy to be here today. Everybody, we love you from our house to your house. Have a happy, healthy, and safe Thanksgiving. And we don't say happy holidays here. We say happy Thanksgiving. We like to take them one day at a time. So good day, everybody. And I guess you guys are going to wrap it up. Back in the studio, back at Triple Five. They're going to shut us down. And again, everybody. And to our president, happy Thanksgiving, Mr. President. Thank you for your service to this country. And thank you for caring about our veterans. Anybody else got anything to say before we wrap it?